Well, the federal government is looking to tighten restrictions on nicotine vaping in Australia. I'm talking about e-cigarettes here. They are those sometimes like colourful and flavoursome devices that people use. You may have seen them. They just kind of pop them out of their pocket, have a smoke, or a vape, and then pop them away. Now, these restrictions proposed include tightening Australia's borders to limit the flow of illegally imported nicotine vaping products and updating advertising laws. All moves designed to stop teenagers from vaping. Yesterday, you may have heard from the AMA, the Australian Medical Association, here on Drive about this time, which wants the rules on importation tightened. Dr. Colin Mendelsohn is the chairman of the Australian Tobacco Harm Reduction Association. Welcome to Drive.
Thank you, Lucy. Thank you for having me.
So do you have any financial or other ties to tobacco or vaping interests? I just want to ask that question first to get it out of the way.
Of course, I've never received money from e-cigarettes or tobacco companies.
So what is your position when it comes to, responding to what the AMA is saying, the Australian Medical Association? They are saying we want it basically completely banned, mostly so teenagers don't get their hands on vaping products.
Look, I think what we need to do is find a balance. Yes, kids are accessing these products and we don't want kids smoking or vaping, but vaping products are an adult consumer product that is actually the most effective quitting aid we have. It's also the most popular, and it has enormous potential to save the lives of adult smokers who can't otherwise quit. So we have to have these products available for adults, but we need to find a balance so that access to young people is restricted.
Can I just ask, how do you think it is an effective quitting product for smokers when it seems like they're just putting down cigarettes and picking up an e-cigarette?
Well, the difference, Lucy, is that vaping carries only a tiny fraction of the risk of smoking. So ideally, smokers should quit altogether, but many people just simply can't. So vaping is a form of tobacco harm reduction. So it's a way of getting nicotine in a much safer form without almost all of the toxic chemicals that cause most of the harm. So it's harm reduction. It doesn't eliminate risk, but it's a far safer alternative, probably at least 95% safer.
And where is that evidence to say it is 95% safer? Because the Australian Medical Association says otherwise.
Look, the evidence comes from a number of sources. The Royal College of Physicians in the UK did a comprehensive review and came to that conclusion. Public Health England also did a comprehensive review. And it's based on the fact that when smokers switch to vaping, they're exposed to a dramatic reduction in toxicants. There are over 7,000 chemicals in smoke, in high doses. In vapour, there are about 100 chemicals in very low doses, mostly less than 1% of the concentration in smoke. And people who switch have substantial health improvements. They have improvements in their health. They have reduced poison levels in the body, the biomarkers, and they feel much better and have reduced symptoms. And when you take all that into account, a 95% reduction in risk is a reasonable ballpark. I mean, it's not an exact measure, but it's a guide to the ballpark relative risk between smoking and vaping.
So it's still safe to say, though, that it is dangerous to vape?
No, I wouldn't say it's dangerous. I would say it's not risk-free, but the risks from vaping are actually very small. In spite of the exaggerated media reports we hear, no one has ever died from vaping nicotine in the world. 8 million people die every year from smoking. The doses of chemicals we're talking about are very small. And this is a product designed for adult smokers. It's a safer alternative. It's a substitute for smoking. So if you make that switch, the idea is that you will dramatically reduce your risk.
If it is designed then for adult smokers, why are they so colourful? Why do they come with all of these amazing sounding flavours like pineapple, strawberry, raspberry, whatever it may be?
Lucy, this is a result of our failed regulatory model. So what's happening is the government's made these products available only on prescription. Now, doctors have rejected the prescription model. Less than 1% of doctors are publicly listed as writing prescriptions. So it's almost impossible for vapers to get legal supplies of nicotine. So they're going to the black market. The black market is thriving. And the black market's also selling products to young people. And yes, these coloured models are illegal and they're imported illegally and they're being sold to children. But what we want to see is regulated quality products imported for adult smokers. And yes, there's no place for these illegal products, but that's what our regulatory model has created.
So, regulated quality products for adults. The Australian Medical Association says, I spoke to Dr. Danielle McMullen yesterday, the Vice President of the AMA, and she said she wants to see basically everything banned except for GPs being able to give people a prescription for vapes so they can go and I guess pick it up from a pharmacy or whatnot. Is that something that you would I guess, support, or do you think it should be more widely available for people so they don't just have to go to the doctor and then go and pick it up?
Well, I think it's important to understand that people don't need to go to a doctor to get cigarettes. And we really should be making it easier for people to access a product that's far safer than smoking, not more difficult. There's no country in the Western world that requires a smoker to go to a doctor to get a prescription for nicotine. And the reality is that patients won't do it. They don't see this as a medical treatment. Sorry, my alarm just went off. They see this as a pleasurable substitute for smoking, which gives them the nicotine that they're addicted to, but without the chemicals. And they don't go to a doctor. It just doesn't happen. And in other Western countries, what happens is that vaping products are adult consumer products that are available from licensed retail premises with strict age verification. And this is working really well in New Zealand and the UK. So youth uptake is very low, but the products are available as life-saving products for adults who need them.
Just before I let you go, I did, as I say, speak to Dr. Danielle McMullen yesterday from the Australian Medical Association. Here's a little bit of what she had to say outlining the health risks of vaping.
But vapes themselves are dangerous as well. There's no way that blueberry-flavoured liquid is safe for your lungs, and we know that vape liquids contain toxic chemicals that can be, in the short term, even damaging to your lungs and cause severe and life-threatening lung issues in some cases. They've been linked to dental decay, increases in heart disease and stroke risk factors. And then the great unknown is we really don't know what these do over the longer term.
How do you respond to that?
Look, I think calling them dangerous is a gross exaggeration, which is not based on the evidence we have. Yes, they're not risk-free, and we're not suggesting they are. The toxic chemicals they have are, as I said, smoke has roughly 7,000 toxic chemicals in high doses. Everything has chemicals, but the doses in nicotine vapes are mostly less than 1% of what they are in smoking. So, yes, there's a small risk, but it's actually quite minimal. And if you're a smoker who switches, you're going to have significant improvements in health. They do not cause serious lung disease. That's a myth. There's claims that vaping causes popcorn lung and EVALI, which are serious lung diseases. Nicotine vaping does not cause those conditions, and that's being confused with other chemicals that are inhaled. And as far as the unknown long-term risk, we don't know the precise long-term risk, but we know that the long-term risk is highly likely to be far less than smoking. The Royal College of Physicians in the UK says the long-term risk from vaping is likely to be no more than 5% of the risk of smoking, and probably a lot less. And look, we need to monitor this over time and look for any unexpected problems that arise. But if you're a smoker who makes the switch to vaping, you will have dramatic improvements in your health. And we know that 2 out of 3 long-term smokers will die from their smoking. So any small risks from vaping, I think, pale in comparison to that.
Dr. Colin Mendelsohn, we'll leave it there. I think it's a great point to end on and really important to hear your views on this one. Thanks for your time.
Thank you, Lucy.
Dr. Colin Mendelsohn there, the chairman of the Australian Tobacco Harm Reduction Association, and he did say at the start of the interview he has no financial or any other ties to tobacco or vaping interests.